One of the really curious things about the TMACS decision aid is that we include a predictor of pain radiating to the right arm or right shoulder. And many people ask about that. They say, well, classical cardiac chest pain should radiate to the left arm or left shoulder, not the right arm or right shoulder. So why is that in there? Well, interestingly, lots of previous research has shown the same thing, that pain radiating to the right arm or right shoulder is more differentiating than pain radiating to the left. Let me just illustrate that for you. So if we take all of the patients with a myocardial infarction and we ask, did your pain radiate anywhere? 34% of them in our original derivation study said the pain radiated to the left arm, versus only 17% who said their pain radiated to the right arm or right shoulder. So you say, well, that backs up the textbook assertion that pain radiating to the left arm is classical, so still doesn't explain why it's in TMACS. The answer to that, though, comes in looking at the patients who didn't have myocardial infarction. So the patients who didn't have myocardial infarction, 34% of them had pain radiating to the left arm. It was basically the same as the proportion of patients who had an MI. So if you say your pain radiates to the left arm, you've got just as much chance of having an MI as not having an MI. It doesn't differentiate. Whereas the proportion of patients whose pain radiated to the right arm or shoulder who didn't have an MI was only 5%. So it's a difference from 17 to 5. So if your pain radiates to the right arm, it makes it more likely, compared to baseline, that you're having a myocardial infarction. And that's why it's in there. So how do we score it? Well, we ask if the pain spreads anywhere. If the pain spreads to the right arm or right shoulder, of course, we classify that as yes. But what if the pain goes to both arms or both shoulders? Classify it as yes, because it still goes to the right arm or right shoulder. In fact, if the pain goes to both shoulders or both arms, it's even more likely to be a myocardial infarction. So we tick yes for those patients as well. That's why pain radiating to the right arm or right shoulder is in there. That's why it's useful, and that's how you score it.